Well, we are really excited here today to tell you more about this plan, Your Land, Your Plan. But first, I want to thank Cameron and the staff of the League for the wonderful work you do. We live in these cities that you manage, and we appreciate the help that the League provides in making our cities livable and enjoyable and great places to raise our children. So let's give Cameron a round of applause and all of the staff members. Thank you so much. And Mayor Ramsey, thank you for all that you do. We want to be on your team, and I agree with you that this team here is the best of the Team Utah. Thank you for all you do. As the mayor said, I'm joined today by my colleague, Shalene Gee, and by Bert Zimmerly and Mikhail Moore of Intermountain Healthcare. And we're here to tell you how excited we are about this plan, Your Land, Your Plan, and how much we support it. This plan matters to Zions Bank and it matters to Intermountain Healthcare because local needs, local priorities, and local solutions, your needs, your priorities, and your solutions matter to us. When people think of cities, they often don't think of them as real estate owners. And sometimes cities themselves know more about what they owe than about what they own. But cities all across the country and all across Utah own billions of dollars in assets that can help finance and otherwise support their futures. This is the basic concept behind Your Land, Your Plan. But we also know that understanding and managing real estate can be extremely complex and sometimes daunting. The intent of Your Land, Your Plan is not to identify surplus land that you can sell for a one-time financial gain or to give it away. The intent is to help you unlock the value in the land you own and put some of that value to generating new revenue streams and new land uses that can support needed services and infrastructure while also reducing the local taxpayer burden. The real estate you already own could be a solution to many of the challenges you face and could be a key tool for realizing the great opportunities you have. Your Land, Your Plan is the culmination of several years of work that Zions Bank has supported across the state in partnership with the League and with Intermountain and with individual cities to help think about real estate assets in a new way. A few years ago, we thought it was critical for Utah to undertake a demonstration project approach to understand what cities needed to fully understand the value of their real estate and to help provide proof of concept and some education on the topic for all of us. I've asked my colleague, Shalene Gee, to share a little bit about what we've learned. Shalene.
Thank you, Scott, and thank you, Mayor Ramsey. You've been so great. We love partnering with the League, and we're so excited about this program and so happy to be here today. Your Land, Your Plan is for cities. It's tailor-made for your city, no matter where you are and no matter what size of city you have. For 2 years, we've been working with the League and with cities and towns across the state to understand the issues and the opportunities that you face in relation to the real estate that you already own. We've talked with cities and towns in rural, suburban, urban, resort, and tourist destination areas all over the state. These conversations have helped us learn and identify what are the typical obstacles that cities face and also what are the tremendous and very unique opportunities that each individual city has. This program is designed to meet you where you are at, wherever that may be. One of the first issues we learned that many cities face is where to even begin. It's a basic issue. Where do we start thinking about this? Knowing what you own is a primary critical step. Our work across Utah has shown us that most cities own millions and even many billions of dollars in assets that are being overlooked or underutilized, and sometimes being sold for far less than what they're worth to you. Your Land, Your Plan is designed to help you figure that out in a nuts and bolts kind of way, very practical. Where do you start? What do you do? Once you know what you own, then what do you do? Your Land, Your Plan is also designed to help you figure that out with some specialized assistance, no matter what your unique and individual goals are. For example, we talked with cities who wanted to know how their real estate assets can generate new revenue streams that are going to flow back into their budgets and can be reinvested back into the community to help offset costs for infrastructure, water conservation, existing services that you're already paying for, job growth initiatives, and to fund housing, education, and other needs, while also reducing local taxpayer burden at the very same time. We also talked with cities who wanted to develop their real estate assets to help build housing on the land that you own, to build better transportation, improve utility access, and other important building projects that matter to you. And we talked with cities who wanted to uphold a commitment to open land, parks, watersheds, green space, trails, and figure out ways to sustain that commitment financially. All the cities that we talked to needed and wanted partners in order to be able to do all of this well. And they also asked for help identifying and bringing the right partners and their financial resources and their technical expertise to local tables. We think these partners need to come to you and meet you where you are. And on that note, I'd like to turn to my colleague and friend, Mikkel, to share why this effort matters to one of our anchor partners, Intermountain Healthcare, and how we're supporting it together.
Thank you, Shalene, and thank you, Scott and Mayor Ramsey. We're honored to be with you today and partner with the League in this effort. I'm Mikkel Moore, as was said, Chief Community Health Officer for Intermountain Healthcare. It's a role that gets me the opportunity to connect Intermountain's resources with the very best assets in our communities to improve health. And I'm happy to be here representing Intermountain Healthcare in the launch of Your Land, Your Plan, alongside our colleagues at Zions Bank. As a co-anchor with Zions, we aim to help you approach your built environment, planning and public real estate planning and management in ways that address the social determinants of health. Now that's a mouthful. I'll say more about the social determinants of health in a moment. But first, I want to let Intermountain's CFO, Bert Zimmerly, speak about why we're co-anchoring a statewide real estate initiative with Zions Bank, not the typical role of a health system. Bert.
Thanks, Mikkel. And Mayor, wow, you are a tough act to follow, I have to tell you. And Mayor Ramsey said she's not a script follower. I'm not either. And Scott and Mikkel particularly know that. So you've got Mayor Ramsey, you've got Shalene, Scott, and Mikkel. And then you got Bert Zimmerly, an accountant, you know. So here I am with all these luminaries. And you got an accountant. Like, why would you have an accountant up here? And you know the difference between an introverted and extroverted accountant, right? The introverted accountant looks at his shoes when he talks to you. Extroverted looks at your shoes. So I'm going to try real hard. And Mikkel said I have 3 minutes and 35 seconds. So I'm going to try very hard not to look at my shoes when I do this. But so why are we here? It's simple. Intermountain was formed in 1975 with the donation of 15 hospitals from the Church of Jesus Christ of Latter-day Saints, with the charge to be a model health system. And usually with a donation of that size, it comes with significant restrictions. The only restrictions put on that new board were the ones they would put on themselves. And I'm impressed with what I've heard and seen already here today, the vision you have, not putting restrictions on self-interest and what you do or who gets the credit. So why we're here is simple. Healthcare and health is no longer just about taking care of you when you're sick. Now, when we do that, we hope we do a great job. But we need people to be healthy, get upstream, provide wellness and preventive services. Scott Anderson may remember this. About 10 years ago, I went to his office on another matter and said, Scott, could we envision what a healthy Utah would mean? And a healthy Utah, in part, is what you're doing today. And as part of what as cities and towns you do for our communities, our residents. And so why we're here is simple. We're a part of you. Our 40,000 caregivers, employees spread across the state, volunteers, physicians, and others, we're part of you. We're all in this together. And we're all about making Utah a healthier state than it is. So with that line, idea in mind, Intermountain is committing $500,000, $250,000 this year and $250,000 next year to support your land, your plan. And we're excited about it. We're committed to it. And we also have real estate spread across the state, and we're hoping that can be a part of how we do this together. One other thing I'll mention, in our investment portfolio, we're a pretty large company, and Scott was on our investment committee a few years ago when this decision was made. We made a commitment of 2% of that portfolio, small percentage, but a pretty big dollar amount, to what we call impact investing. Try to make an impact. So we will purposely take a lesser financial return, but we want to measure a social return coming back to our citizens, our states, and our residents. So we want to work. We have our real estate people here today, of course, our community health people here today, and we're excited about doing this. We're your neighbors, we're your friends, and we're excited. So with that, I'll give it back to Mikkel.
Thank you, Bert. Thank you, Bert. So our reason for being involved is simple. As Bert said, it's about our mission, which is helping people live the healthiest lives possible. And we understand that the care we deliver in our hospitals and our clinics, and now more and more in the home and via telehealth and digitally, is an important part of creating health in our communities. But in best case scenarios, contributes only about 20% to the likelihood of whether we live a full and complete healthy life. What contributes more is the environment in which we grow up, the cities that we live in. And that's why Intermountain is being really thoughtful about how we partner, join your team in creating healthy communities. And so when we talk about the social determinants of health, we mean having access to healthy food. Certainly nutrition is medicine, we've learned, but it's bigger than that. Do we have complete streets so people can walk to get their groceries or walk to school? Do we have parks where people can recreate and gather? Do we have opportunities to get a good job, opportunities for education, and balancing all of those things together to live a healthy life? So as we think about your land, your plan, our hope is that we have the opportunity to partner with you. We're happy to be an advisor around the social determinants of health. We're happy to be a partner. We are a neighbor in many cases, whether it's our caregivers who live in your cities, or if we have a building and a service we're delivering right in your community, we probably have the opportunity to connect those and think about how we create access to good jobs, how we create opportunities for investments, and Bert's offering his money up for investments. And if we have a local supplier that we could be purchasing from, because that creates a more vibrant economy in your communities that we can help support through our organization. So we hope you will look for Intermountain to be a resource, and a partner in all the ways we hope to be as an anchor in this community contributed to health. So I'd like to mention again our partners. We have our community health and our impact investing team here at a station in the exhibit hall who would be happy to talk with you more about the social determinants of health. The state has already prioritized integrated housing and transportation, two key social determinants of health, and we think we have the opportunity to advance these ideas. The Your Land, Your Plan articulates and outlines ways to embed social determinants into your planning processes as you implement state priorities to benefit the long-term health of your community and your community members. So thank you for all you do to make Utah a state where everyone can live healthy and rewarding lives. We look forward to what develops through Your Land, Your Plan, and to being your neighbor and your partner. Thank you.
Well, thank you, Mikkel, and thank you, Bert, and thank you, Intermountain, for your generosity and for your leadership. They are great partners for this community, and we are happy to be partnering with them and the League on this program. Investing in the future of Utah cities and towns doesn't mean just spending more money, though it always helps to have more money to spend. And in addition to the tangible resources and the technical assistance we're devoting to Your Land, Your Plan program, we want you to know that we are listening. Through this program, we hope that we will learn a great deal about what you need and what you want, and how we can help you achieve that and what we can do to further partner with you. And it means putting policies in place, including at the state level, that will help cities better use their assets to maximize their efforts and priorities in a positive way. Let me conclude by saying that from my perspective, smart public asset management is absolutely critical for your city's economy and for the future of every town and neighborhood in Utah. Every member of your city and town deserves the chance to prosper and to help them do what they need to do. And this is a plan that will help you help them. We are thrilled to be able to share our perspective about this important program with you and to support each of you going forward. So thank you very much. We look forward to partnering with the League and every city and town in Utah in Your Land, Your Plan.